guys, today's vlog is going to be about the truth about cancer. One of my friends got diagnosed with cancer not too long ago, and I knew it affected you, which is why I started the group Kids for Healing, except I didn't know how it hurt you. I didn't know what kind of pain it was or what it was like. So today we're going to interview Lisa, who was my inspiration to start all of this, to find out the truth about cancer. Stay tuned. For Healing, and I'm here with Lisa, who was my inspiration.
Hello.
Today I wanted to ask her a few questions about her experience with cancer. What emotions were you going through when you were diagnosed?
Well, the first emotion I was going through is I was never going to see, this is hard, I was never going to see my grandkids again, my daughter again. It's hard. And I was never going to see my grandkids grow up or get married or anything like that. It was really hard. The first thing I thought it was my grandbabies. That was the hardest thing.
What was your chemo like?
My chemo is hell. And that is the only way, that's the polite word I'm using. It is hell. I have this little, come closer so you can see it. Come closer, banana head. See this little thing right here? Come closer, Katelyn. See this little thing right here? You see it?
Yeah.
Okay, this is my little port. It's under my skin, and there's like a little tube that goes here, and there's another one that goes down. And this little port is where they do all of my treatment. And this was put in me when I had my breast removed. This was surgically put in me. So when I'm done with all my treatments, I then have to go in and have it surgically removed out. And I can't wait for that freaking day. Anyways, so what they do is I got to go in for treatment. My treatment takes about 3.5 hours every time. And first they got to put all the medicine in it. They got to put like the nauseated medicine and then the allergic reaction medicine and some other medicines. And they just put a bunch of medicine in it first. Then once they get all that in, now with my chemo treatment, what they have to do is they have to call over to the pharmacy at the hospital. And I'm in the same parking lot as the hospital. They have to call over to the pharmacy and get my chemo made right away. My chemo has to be put in my body within an hour of being made. If it is not put in my body within an hour of being made, it's no good. So as soon as they get the chemo, they got to come over and they got to put it in. So they do all my other medicines first, then they put the chemo in. And they have to wear a gown, gloves, and a mask when they put my chemo in, and they have to sit next to me and do it. It takes about 5-10 minutes to push the chemo in me. And the reason why they have to wear the gowns and everything is so that if it splatters, it doesn't get on their bodies. I never really got an answer why, but that's it. So as far as my chemo side effects, everybody is different because everybody has different types of chemo, the strengths of chemo, how much of chemo, how often of chemo, and everybody's bodies are different. Like mine is very sensitive, and mine is very sensitive to everything and anything. So I think I'm getting a lot more side effects than most people. But there are a lot of side effects out there, and there's a lot that can happen to your body during chemo and after chemo. I have had, of course, losing my hair, as you can tell. And I have had mouth sores in my mouth. My tongue feels like it's burnt. And I've had blood coming out of my butthole. I've had my butthole hurt really bad. I have bones and muscles that hurt really, really bad. I can barely walk, barely move. My nerves shoot sharp pains through my body. Trying to think of everything. I get chemo brain now too. So chemo brain is where you forget things, or you're in the middle of a conversation and you just forget what you're saying, or you get lost, and that's called chemo brain. And
Wasn't there a side effect when you had your head, like whenever you wore a hat and then it hurt?
right, yeah. Since my hair started falling out, what it feels like now is I first had my head shaved, as you know. I had my head shaved like you. because I didn't want like globs of hair falling out. I just wanted little pieces falling out when it does start falling out. So what happens is it feels like something is cutting. Like when I go to wash my head in the shower, I can't like rub it like, you know, you can probably rub yours. I have to kind of pat it and wash it, because, you know, even though I'm losing my hair, I still gotta have a clean head. You know, Mr. Clean, Mr. Clean. Anyways, so try to make it a little funny there. Anyways, so what it feels like is it feels like a bunch of knives are cutting my head, or a bunch of needles are in my head, or it's like poking my head really bad, with all the hair falling out, and that's because all the hair follicles are dying and stuff. So it hurts really bad. So if I lay my head like on the back of the chair, or if I was to rub my head like this, or lay on my pillow, or even put I have a hat that I wear out in public, and if I put that on, it just feels like something's totally cutting my head, or poking, or just, to me I call it cutting, because it just feels like something's just cutting my head, poking it really bad, and it hurts, and it's really sensitive, and it's really sore. They also said that once all the hair falls out, my head will probably be very sensitive and sore also, which, knowing me, that's probably going to happen. And also, there's a lot of things you can't do during chemo, like you can't shave. If your hair hasn't fallen out yet, you can't shave, because your white blood cell counts go really low when you're doing chemo. So if I was to cut myself, that little cut can turn into a very severe infection. I could wind up very sick or in the hospital. That's why it's hard for me to go around anybody that's sick. Nobody can come around me that's sick. I can't go in a lot of public places or touch a lot of things, because any little thing can get me very sick. So not only getting chemo sick, I can get sick from other things and other people. But I've had a lot of bad side effects from the chemo, where some people don't have as many. But it's just complete hell, and especially when the bones and the muscles hurts, because I can barely walk, barely move, barely do anything. And I don't want to sugarcoat it or say anything, but me personally, it's miserable and it's hell. And I hope I don't ever have to go through this again, and I don't want to ever have to go through this again. And I wish that everybody else in this world and in other countries and everywhere would never have to go through chemo, because I think it's just horrible. I think I'd rather have another surgery than go through chemo, because at least surgery, you heal and you get better from it. Chemo, you get worse and worse and worse and worse and worse from it, and then once you're done, then you start getting better from it. So you do like a butt backwards thing, but it's just really bad. And I just hope nobody ever. I wish that nobody would ever have to go through this ever.
What was going through your mind throughout this?
Throughout it, or because I'm still going through it? You mean?
Yeah.
You mean when I first found out?
I mean, like, still, like, now, like, when you first got it, you were sad because you didn't think that you were going to see your grandbabies and stuff.
Right.
But now that you had the surgeries and stuff, what's going through your mind?
Oh, I'm just so tired and exhausted. I just want to get it over, because I'm doing all the chemo and all the treatment and everything, and it makes you very sick. And so right now I just want to get it all over. And there are point in times where I just want to stop doing it too, because it makes me so sick and it takes a lot from me. But on the other hand, I want to get through it too, so I can start, you know, being around my grandkids again and living my life again. It's a hard situation.
Yeah, I bet. How did you feel? Like, whenever you started chemo, how did you feel?
When I started chemo?
Mm-hmm.
You want to know what happens to my body when I'm doing chemo? Is that what you want to know?
Mm-hmm.
Well, I've had 2 treatments, and I still have a lot more treatments to go. Chemo just really takes a lot from you. Everybody's different. Everybody handles chemo different. Everybody has different strengths of chemo, different types of chemo. But for me, when I had my first treatment, I'm very, very sick, very nauseated, and I have to take lots of medicine. and then my bones and my muscles hurt really bad, and I can barely walk. And it does things to the bladder sometimes. It does things to other parts of your body that hurts and aches, and you just sometimes can't even move. You can't get out of bed. You have a hard time eating or drinking anything. I got acid reflux really bad. I have sores in my mouth. There's a lot that happens, and each treatment you have, the symptoms and the side effects get worse and more things add on to it.
How has having cancer changed your life?
It's changed my life because it's taken everything from me. Because I have cancer and I have to do my treatments, it's taken everything from me. Because like I used to always watch my grandkids for my daughter and my son-in-law, and now I can't even watch my grandkids anymore. I can't even have them over for a visit without somebody being here with them, because I can't hold them, I can't carry them, I can't pick them up, they can't sit on my lap because of my chest and the surgery of my breast being removed and my port, and all I'm just all bone and skin right here now. I don't have any fatty tissue, so I have to be very careful, but I can't hold them anymore. I can't play with them on the floor. I can't do anything with them really that much anymore. And also I can't really clean house. I have a hard time cleaning house. If I need to do it, I have to push myself, and I'm so sick that it's so hard to clean my house. So sometimes it takes me 3 or 4 days to get the housework done. I can't really stand that very long because it causes me, if I stand too long, I gotta sit down because I'm gonna get sick or pass out. It's hard for me to cook meals or even make a sandwich because I get so sick just standing in the kitchen. I can't drive because of my arm, because they had to remove lymph nodes from underneath my arm, so I have to be careful, and we're trying to prevent possible lymphedema. So I am unable to drive my car because my arm isn't where it needs to be. I can't maneuver it very well. I have to wear this on my arm, and so I can't drive either. I can't just go to the store. I can't do a lot of shopping or go very many places or do things because I have to be very careful because my white blood cell counts are so low that if anybody's sick or has the flu, I can get it. And it can make me very sick, and I could wind up in the hospital or on a lot more medications that I'm already taking. It's totally taken my whole life away. Whole life. I can't be independent. I need help from people, and if I don't get help, I have to push myself to do it my own self. I can barely do laundry. So it's taken my whole life away. It's just completely stopped my life. And until this chemo treatment is over, I won't have my life back.
How have people reacted to you since you've had cancer?
You mean how have friends and family treated me?
And people on the street, just in general, how have people reacted to the cancer or treated you differently? Or
like before when we went to the store, did people like comment on you?
Nobody makes any comments, but now, as you can tell, I'm losing my hair. And right now, because I'm losing my hair, it hurts really bad to wear a hat. So I sometimes go to the store to get my prescriptions or to the store to get a few things. I very rarely can go anywhere, but when I do, and there are people, as soon as I walk in, people stop what they're doing and they stare and they follow me with their eyes. So they're watching me walk past them and they're staring at me like as, you know, if I have something, which I do, I have cancer, but they're looking at me really badly, like what is wrong with her? You could just tell the look on their face. What's wrong with her? Look at that contagious person, or you know, there's something really, that lady's scary looking or something. You can just tell by the expression on their face that they're thinking all kinds of things. They also, sometimes when I have to get close to them at the cash register or to hand them money or do what I got to do, they back up a little bit, like as if they know I have something, but they may not know what, but they back up or don't want to touch me or get close to me because I think that they feel they're going to get whatever I have, and that's the impression that I get. Now, as far as friends, there's a lot of friends that talked to me at first, and now they don't talk to me at all. And family members mostly talk to my mother. They don't talk to me, but that's normal. But as far as friends go, I'm really shocked because a lot of these friends have been my friends for years. And a lot of them just chose to talk to me at first and then got a little nosy and asked quite a few questions, and now they choose not to talk to me at all. And a few of them have made statements that they are scared that I'm going to die, and that's the reason why they haven't talked to me. They want to remember me the way I was and the way I looked, so they don't want anything on my website page, Facebook, because it bothers them and upsets them and hurts them to see pictures of me with my hair like this, or to see me looking so sick that it bothers them and it hurts them and it scares them. So they don't want me to have anything on my Facebook because it bothers them more and scares them more. But I also think that if you are my true friend, regardless of what scare you're going through or what hurt you're going through, or you're scared that I'm going to die, or if you just don't want to see me like this, or if it bothers you or hurts you, I still feel that you should still be there as my true friend and my supporter, because I need all the support that I can get. And I'm not getting very much of that. A word here and there is not support. A statement here and there on one of my pictures or on something that I posted out there is not being very supportive. I need calls. I need hugs. I need kisses. I need people to tell me that they still love me and that they're still there for me. I don't need people to tell me that they're scared I'm going to die and that it's scaring them and it's worrying them. So that's why they don't want nothing to do with me, or they don't want to see me like this. You can still talk to me on the phone and not ever have to see me while I'm going through this. You can still be there for me on a phone, and you can talk to me, and you can tell me you love me on the phone and say I'm sending hugs your way. I'm there for you. Call me every day or every couple days. That can be very supportive too. If seeing me scares you or seeing pictures of me scares you, then don't go on my Facebook no more. But Katelyn has done a lot, and she's gone so far with this ever since I've had cancer, and it has inspired her to do everything that she's doing, and she has gone so far with this. I mean, with her Facebook webpage, with the Relay for Life coming up, which I'm going to be unable to make, and the Applebee's thing, and being on the news and in the newspapers and everything. She's gone so far with this because of me. And Katelyn used to be like this little turtle, and she used to be in her own little shell. She never talked really. She never really had any friends. She never really wanted to associate with people. She was just in this little shell and just kept to herself. And it's amazing. And, you know, she used to be a little bit of a whiner and kind of glued to her mom, and it's the truth. And because I got cancer, Katelyn comes out of this little turtle shell, and now look at where she's at today. She's talking on the news. She's talking in papers. She's doing Relay for Life. She's doing all these videos on YouTube. She's doing her Facebook page. She's doing all of this. What? Because I got cancer? If it takes cancer for her to become a young lady and a woman and to do all that she's doing, then that's great. But she needs to keep going with what she's doing. And when I share her post out there, I'm doing it because I'm supporting her, because she's supporting me. So when I share her YouTube videos and when I share her Facebook page or all that she's doing for Relay for Life and all of that, I'm sharing it because I'm supporting her and because I'm trying to get people to support her as well, and to go to these Relay for Lives and watch her YouTube videos and do everything for her too, because she now needs support, because without support and without people helping her, she can't get all this money that she's trying to raise or do all this stuff that she's trying to do for other cancer patients as well as me that need help and need money and need stuff. And because of her, we need to support her too.
Is there any advice that you have to give anybody who's recently been diagnosed?
It's a really hard one. The advice I do give is to get mammograms every 6 months or every year. You know, if you ever feel a little lump or something just not right with your breast, always check your breast, even if you're 18, 16, 15, because anybody can get cancer. Anybody, male, female, baby, child, infant, teenager, adult, elderly person, anybody can get cancer. But as far as me, I had the breast cancer. So I think that even a young girl, even Katelyn's age, Katelyn's starting to mature. She's starting to get her womanly parts. She needs to start, it's true, she needs to start examining herself in the shower. There's breast examinations you can do in the shower or just laying on your bed or something. And because now, you know, her hormones are changing and all these young girls' hormones are changing, you could get a little lump or something. So always check yourself, you know, always, young girls, teenagers, you know, everybody, check yourself all the time at home. And if you feel something, then get to a doctor right away. And also, when you get older, I know they don't do mammograms on younger girls until they are older. But if a younger girl does feel a lump, then they will start doing mammograms and stuff. So that's why I feel it's very important that younger girls also check themselves on a regular basis, because there might be a lump that might show up, you know, and then they can get mammograms and stuff. But as far as the older people, get your mammograms all the time, as well as check yourself all the time. And, you know, like in my case, my grandson found my lump. I went and had my mammogram the next day. My grandson was sitting on my lap, and I was like, ow, that hurts, because his head hit my breast and there was a lump there. So I thought maybe the mammogram just kind of irritated me, and come to find out, it just popped out and said hello, and it just happened to be the day after my mammogram. But my lump never showed up on the mammogram. My grandson found it, and because he found it, we found out I have cancer. So sometimes they don't show up on mammograms, but still, just try to always check yourself and get your mammograms. And, you know, if you ever notice anything, also there's rashes that can show up on your breast. You can get rashes that show up. Those are also signs of cancer or possible cancer, rashes. Your breast changing different shapes, that can show that you might have breast cancer. Also, if your nipples go in or dent in and do other strange things, that's also signs of possible breast cancer. There's other things than getting a mammogram or checking or getting a lump. There's other different things that, so if your breasts don't look right, if your breasts don't feel right, if you feel lumps, if there's rashes, or your nipples are doing different things, or you're leaking stuff out of your nipples, anything, always get to the doctor, because there could be signs of breast cancer as well. And I think that everybody should keep an eye on it, and, you know, young, old, and middle-aged.
If there's one lesson you learned from all this, besides getting mammograms, what would it be?
One lesson?
Yeah, like one important lesson to know.
Lesson? I don't know exactly what you mean by that. Give me an example.
Like you said, that everybody should get mammograms and stuff, because of what you went through, and that's one of the lessons you learned. But what's another?
I don't really know another lesson, to be honest with you. I mean, because you just gotta check yourself, and there's a lot of people who don't. Like, after I got breast cancer, I tried to tell my family, the females in my family, that they need to go get checked. Everybody just blew it off. I have my mother, who doesn't go on a regular basis and get it checked. I have my sister, who doesn't go on a regular basis, who doesn't get it checked. They could have it. They might get it. And I think, you know, it scared me. And it still scares me. And chemo scares me the most. But I tried to tell my girlfriend, Kim, I tried to tell her to go get checked. And she's only been checked once since when she was 40, and she's now 46. So I don't know really what to say. It's just a lot of people that I did try telling to go get checked didn't get checked. Now your mother went and got checked because she got scared.
Yep.
And that's a good thing that she got checked, you know. But there's people that I did try telling to get checked, friends and family, and none of them have chosen to get checked except for your mom. And now that you're getting more mature, you need to keep checking yourself. Just even with your hands, your mom can show you how. There's things on the internet. There's even doctors that can give you little pamphlets that show how you can check yourself just at home with your hands. And also keep an eye on yourself, because you are maturing now and you're developing, and you need to keep an eye on yourself too, because no one says that you have to be my age or older to get it. You can still be young and get it, but don't think that you will, because you won't. Because poof, you're not getting cancer. Nobody's getting cancer. I don't want anybody to go through this, ever. And I don't want to ever see anybody go through what I'm going through. The surgery was not bad. I mean, yeah, it hurts and everything, but for me, taking my breast off did not bother me. Having my hair go away does not bother me. It's the chemo and the treatment that bothers me, and knowing that I had cancer. But it's mainly the treatment that really, really has taken a toll on my life. It's made me depressed, sad, down, alone. It's made me angry. It's made me have so many emotions having chemotherapy. And that is, I think, the worst for me out of all of this is the chemo. But I'll tell you what, right after my surgeries, my pee was pretty. It was blue.
Would you say that was the best part about it?
The best part was my pee being blue. It was pretty. It was an aqua blue. It was pretty. That was from my first surgery. But that's just a little funny to throw in there. But I don't know. Anything else?
I think that it's important just to stay positive and remember that you're not alone, and there's many more people with it.
There is a lot more people with it. Yes, you're right. And there's a lot of people, men and women and children, babies, older people, teenagers. There's a lot of people that have different types of cancer. You are correct. But sometimes what I mean by I feel alone is friends and family. And when I need someone here, I don't need someone here sitting on my couch watching TV. I need someone here to talk to me and let me cry. Let me tell you how I feel. I need somebody to listen to me, like how you're talking to me and you're listening to me, and how you guys listened to me before we started the video. That's what I need. Even if I bore you stir crazy with all my cancer crap, I just need someone to listen what all the hell I'm going through and be there for me. I don't need someone to sit here on my couch and wonder what next movie's coming on. Or, you know, because I don't go anywhere much or do anything, so if anybody does visit, it's here at the home. But I'd rather you listen to me and just let me cry, or let me tell you how I feel, or just tell you all about what's going on with my cancer treatment. Just listen. Even if you don't want to listen, just look at me and listen, you know, and just hear what I have to say about it all, because I have to get it all out. If I hold it all in and I don't have nobody to listen or to talk to me, it makes it worse on me, because I'm holding it in, and it makes me more depressed, and it makes me more sad, and it makes me more angry, and it makes me want to give up. But when I have people like you and your mom and your brother who are there for me and who do listen, regardless if it gets boring or it's not really interesting, because I know sometimes it does, but that's what's important, because that is what makes us not alone, is when we do have people who will listen. Don't necessarily need hugs all the time and stuff. It's just listening and talking. Because every time you see me, I have nothing else but to talk about was my cancer treatment, because that's all my life is right now. I don't go with the grandkids anymore. I don't do stuff. I very rarely can clean my house and stuff. So the main thing I have to talk about is chemo, 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 chemo. I live, eat, sleep, and breathe chemo. Even when I'm done with my treatment and I gotta wait 2 weeks for the next one, I'm suffering the whole 2 weeks. So I'm still eating, living, and sleeping and breathing it. Can't sleep at nights and stuff, so it's just a horrible mess. And I just need people to listen, even if you don't want to. Bite your tongue and listen. But if you don't want to be around me and you don't want to listen, then don't bother. Because I need people who are going to be there for me, not away from me, and not have anything to do with me. So if that's the case, then I don't need them around at all, because that makes me more sad and more depressed.
Well, thank you, Lisa, for taking time to talk to us.
You're welcome,
We
honey.
love you.
Thanks, love you guys too. Thanks for coming. Thanks
You're
for
welcome.
having me in the video.